Hey y'all, and welcome to my channel. Or if you're new here, or if you're returning, welcome back to my channel. If you're new here, welcome to my channel. On this page, I talk about technology and money. I also sometimes talk about hockey and trending news. If you would please be so kind to like and share the video. Liking and sharing the video does two things. Number one, it helps this content get out and reach more people. And number two, it encourages me to keep creating content that you all find valuable. So I'm excited to be here. I hope everyone has had a good week. But I wanted to do a follow-up to a trend, or well, it's not even a trend now. It's actually becoming a part of healthcare clinical operations across the United States. I'm sure across the world, but I'm mostly following here in the United States. And that is the integration of artificial intelligence into nursing operations. And when I say nursing, I don't just mean bedside nursing. I mean nurse all types of different specialties. I have a playlist here on my channel, Nursing Informatics and Small Bites. I have another playlist called Technology, where I've been talking about, maybe for the past year or two, the increased use of artificial intelligence in healthcare, but also specifically nursing, and how that is changing and has changed how we as nurses practice wherever we are practicing. Okay. So last month I did a few videos on how some nurses across the out west in California are protesting AI. Then there were some nurses at a health system in Tennessee that were calling for ethical use of AI. I've done a story about will artificial intelligence take nurses' jobs? No, it will not. But I came across two interesting articles I want to share with you all. And after this live is done, I'll be sure to leave a link in the description. But it ties into some of the content I read in the article, ties into some things that I shared in those prior videos I just mentioned. So the first one is why a chief nursing officer is excited about artificial intelligence. I'm just going to quickly, I won't read the whole thing. I won't read the whole article. I'll just highlight a few items. It opens with artificial intelligence is perfectly positioned to ease the workload for nurses and give them time back at the bedside. So this is why I say, and I have been saying since I started this channel, that bedside nurses, your skills, your experience, your critical thinking abilities, your emotional intelligence has so much value, not only in how you care for your patients, but also can be transferred into other positions as well. So that's why I say artificial intelligence plus bedside nurses. And when I say that, I mean your experience, your skills, etc., not just your hand, not just your like educational type knowledge, but those other soft skills are just so inherently valuable and holds a lot of weight. So this article goes on. They interviewed the chief nurse executive at a St. Louis-based health system. It has 30 hospitals within their health system. I don't know how many beds, but they have been using artificial intelligence to help nurses pick up extra shifts and also reduce time in the electronic health record. So what this health system is doing is using an artificial intelligence powered app that makes extra shifts available to nurses, also gig workers, and also agency nurses like contract nurses, and letting them know upfront exactly how much that extra shift is going to pay. And nurses are able to do all of this from their telephone, from their smartphone. But this health system is also using artificial intelligence for a nurse handoff. So this artificial intelligence is embedded in the EHR, and it generates reports on patients being admitted to the hospital and from the emergency department. And if you've ever worked at the bedside and have taken an admission from the ER, the ER nurse has to call the nurse on the floor, give report. Sometimes that ER nurse is just so busy, they just can't give you everything in a handoff, or there's questions that you as the receiving nurse just don't know to ask or think to ask. And then the patient gets up to the unit and you're like, now, why wasn't this included in my handout? Why was this critical piece of information not included in the handoff? So what this health system is doing is utilizing AI to automatically generate the handoff reports. And it's standardized and automated, but it also allows the nurse who's generating the report, it just doesn't kick it out. The nurse can still like make modifications to it, which is what you always want, right? You always want a human being validating what artificial intelligence is generating. So with these nurse generated handoffs, this health system started off with a pilot at one unit and then expanded from there. But the thing that I wanted to point out that's related to the article I shared last month, one or two of the articles I shared last month, where I voiced concern of were nurses included in the implementation, because you always want to have nurses at the seat of the table. Nurses should always have a seat at the table of any type of technology implementation, period. Bedside nurses, nurses in management, of course, nurse leaders as well, because that's where you'll have the most success with your implementation. But what stood out to me was this health system said they educated the bedside nurses, they were transparent, they followed up, and having them involved in the implementation was key. We had nurses, here we go. They had the nurses actually doing the validation of the information that was coming across, right? You did not just have purely technical people doing your validations. You always want to have that voice of the bedside nurse. Again, that's where your value is, because nurses who are at the bedside have that knowledge of what to expect and, when information does not look quite right. This nurse leader said we had nurses who were verifying right at the front lines with us, so they knew how it was being generated. They went through a full-scale education and implementation, and they're going to continue to do so. And then they go on to talk about, nurses should not be concerned about the technology replacing their work. Now, this other article I wanted to share really quickly is in that same vein, which reiterates again the importance of utilizing nurses' voices when you're implementing these technologies. And the article is from Health Tech, and it says nursing leadership is crucial to using virtual care effectively. Artificial intelligence can also help providers retain experienced nurses and increase support for bedside care teams. So this article touches on several health systems that are using artificial intelligence in different ways to reduce burnout and give experienced nurses the opportunity to continue working even if they are not at the bedside. So, these health systems have implemented virtual care nursing, which I've talked about virtual care nursing in prior videos. And they're also using artificial intelligence embedded electronic health records to facilitate their virtual nursing, and also do early symptom monitoring in combination with video camera integration with cameras in the patient's room, as well as predictive modeling. Okay. And this is a relatively long article. They talk about the staffing challenges in new technologies and also integrating the AI into nurses' workflows. But what I wanted to call out in this article was, again, reiterating how to involve nurses, bedside nurses, etc., in operational changes and how important and inherently valuable that is. So again, these multiple health systems, but what they said, it worked out really well. It gives nurses ownership of the process, emphasizing that they are valuable. Also gives the nurses opportunity to address concerns, right? Because purely technical people may not understand. They know how the technology works, but they may not understand the impact of certain functions within the AI combined with the HR, how that plays out for the patient, right? So they go on to say involving nurses is essential. They want to make sure the technologies will be utilized by the staff, and that includes utilizing nursing expertise when planning technology solutions and choosing vendors. Nurses will tell you what makes sense and what doesn't. I saw that and I just like, well done. So to wrap up, always remember, registered nurses, LPNs, CNAs, that you have inherent value when it comes to implementing technologies. In combination, your experience, your skills, and your knowledge with these technologies has a lot of inherent value. Your soft skills that come natural to nurses or that are developed over a nurse's experience has a lot of value. Emotional intelligence, critical thinking, and also being involved in these type of implementations with a bedside nurse and all of their skills and experience, being a super user may also open up new opportunities for you as well. So I always encourage bedside nurses to understand and know how valuable and how much weight their clinical skills and experiences hold. Thank you so much for listening to my videos. Thank you so much for liking and sharing. Have a good weekend, and I'll see you in the next video.